kind introduction. Ewan, Kenny, thank you for inviting me to speak today. I thank the meeting organizers. I thank the facilities people because I'm one of the people who is spending a lot of time ensuring that we have good indoor air quality. So I carry around an Aranet sensor. This is a proxy, it measures CO2, 508 ppm, so we clearly have good ventilation. I don't know what else is happening in the room, but I thank the facilities people because that's really important. And ultimately, the facilities people are going to be helping us with the Far-UVC. All right, so I also want to thank my team at Hopkins, Dr. Gigi Gronvall, who's an immunologist, Dr. Richard Bruns, who's an economist, two public health analysts, Alexander Linder and Alex Zhu. And let's see, did I forget anyone? All right, I want to thank the funders who fund me to work at Hopkins, Effective Giving and Open Philanthropy. And I also want to give the disclaimer that there were remarks of my own and do not necessarily reflect the views of Johns Hopkins. All right, so what am I going to talk about today? Well, I'm going to give you a little background about me and why I'm interested in this and why it's so compelling. You and Kenny gave me a great title, but I kind of changed it a little bit because I try to stay in my own lane and talk about what I know about. And so I really don't know that much about infection control, but I do know a little bit about airborne respiratory disease and control of that. I want to talk about why we need Far-UV in what I call the pandemic toolbox. I'm going to talk about what's currently available in that toolbox. I'm then going to share with you some findings, recommendations, and conclusions for a recent workshop and my recommended next steps. Okay, so where do I work? I work at the Johns Hopkins Center for Health Security. The mission is to protect people's health from epidemics and disasters and ensure that communities are resilient to major challenges. The center has been in business for about 25 years. They've run a whole series of pandemic preparedness exercises. We learned some things from those exercises, but there's a lot more that needs to be done so that we have a really robust pandemic toolbox. All right, so we're going to take it a little back. I said background, so we're going to walk back in time. I spent 2 decades in philanthropy at the Alfred P. Sloan Foundation, where I directed the programs in bioterrorism, pandemic preparedness, the microbiology, the built environment, and indoor chemistry, to name a few. And so this is an example of some work that actually was funded by Sloan, but I actually participated in. I have very few papers. I don't publish papers, that's not what I do. I mean, I am an author when appropriate, but it's not my focus. So this is called Improving Performance of HVAC Systems to Reduce Exposure to Aerosolized Infectious Agents in Buildings. Isn't that what we're trying to do? Okay, so here are some recommendations from a working group that was put together in 2005. And what I want to point out, and this is sort of just how I do my work, it's a multidisciplinary group. We have some public health doctors there, and I want to note Tom Inglesby is listed. He was a very junior person now. He is now my boss at the center. There's an epidemiologist there, John Samet, and there are many buildings people. Bill Bonfleth, who I still work with to this day, Terry Brennan, Woody Delp, and more. And so this is just sort of one example of trying to put together a multidisciplinary group and tackle the problem. All right. So I told you I worked in pandemic preparedness, and we had a workshop on what you can do to prepare for flu, probably around the same time. And Steve Morse at Columbia was the PI. Dick Garwin, if you've never heard of him, Google him. He's really quite a remarkable figure in US science and technology. So anyway, we had this workshop, like, what are we going to do before the vaccine arrives? So we wrote this policy piece. It did not mention UV. Fortunately, that other working group did mention UV, but again, it talked about ventilation. All right, so the Sloan Foundation did not fund this work, the 2009 UV guidance from NIOSH, but I want to point out several important things. a lot of what was in this guidance was based on the work of Professor Shelley Miller, who's here today, and I have a picture up there. And also, Ed Nardell played a key role, and Shelley and Ed are listed as reviewers, but a lot of the heavy lifting was done by an interagency task force. And they came up with guidance that is still used today. There was a webinar last week, and this guidance came up. So this is, again, so the point is, there are groups that work in the government trying to tackle problems. They need people from outside of government. They need research from outside of government. And together, with the companies, we make progress. All right, so then, now let's go back to what I was doing at Sloan. Okay, so I say that people are important. Okay, here's Shelley again, this time with Dawn Milton. Again, another figure in UV. There was a workshop in Singapore called, infectious disease transmission in the built environment. Okay, so this is in 2017, and it brought together people from Europe, US, and Asia to just start talking to each other, talk about like what happened in infectious diseases and so on. And so, you may recognize some of the people who came to this meeting, but what it did is it fostered the creation of a community of researchers who might not necessarily know about each other's work or whatever. And anyway, so we had aerosol scientists, buildings people, infectious disease doctors. And Shelley can tell you later how good the meeting was. For some reason, there was no meeting report, but it doesn't matter because these people all work together to help save us from COVID-19. All right, so I'm eliminating a lot from the story, but I also mentioned that I ran the Sloan Chemistry of Indoor Environments program. And very often, a good way to summarize all the work in a program is to work with federal agencies to fund a National Academies study. So in 2022, the National Academies published this report on why indoor chemistry matters. And there are 3 people in this picture. Charlie Wexler, who was one of my advisors when I was at the Sloan Foundation, who is the father, I think, of indoor chemistry. Delphine Farmer, who's a chemist at Colorado State. Dustin Poppendick, who's at NIST. They were 2 of the members of the committee. And they came up with many recommendations, but one was that funding agencies should support interdisciplinary research to investigate the impact of products and services on indoor chemistry, especially under realistic conditions. Now, I left Sloan in 2000 to go work at Johns Hopkins on the pandemic. It seemed like I had the right background. But what's really nice, if you go back and read this report, it talks about the promise of Far-UV. There are papers from David Brenner's group referenced in this study, also Carl Linden's group, and there are many. One of the things I'm fortunate is to work with really great people. I mean, if you're in philanthropy, my approach is it's really talent management. Find the right people, help them find other people to work with. They come up with better ideas and really make good progress. So other people's work who's included in this report are Jose Jimenez from Colorado, Nick Carslaw, who's here from New York, a marvelous modeler, Faye McNeil, who I'm so happy is now working with David and the team at Columbia, Jesse Kroll at MIT. And again, this is sort of a community of people working on indoor chemistry. And when I was envisioning the program, I never thought people were going to bring UV into the room at 222. All right, so I didn't anticipate photochemistry. All right, so why do we need Far-UV? If you traveled here, you must have a pretty good idea of why we need it. We have all these companies here. All right, so I'll tell you why I think we need it. And this is just my focused approach. All right, for the next pandemic. COVID, if we look at the last one, eliminated a decade of progress and life expectancy? Really? It was terrible. 1 million people died in the US, 15 million people died worldwide. Okay, I have some reference here. This is really terrible. All right? Right now in the US, bird flu in cows, all right? It's not very good, all right? There are all sorts of challenges to working in agriculture and testing and who the workers are. So I really hope this doesn't start a flu pandemic or epidemic. All right, Ed, I'm bringing you up again here. Tuberculosis. There was a recent publication that's talking about all of the pathogens and which ones are highest in killing us, and TB wins, and really Far-UVC can help that. All right, so what's in the pandemic toolbox today? All right, so I'm going to talk a little bit about medical, administrative, and engineering countermeasures. All right, so diagnostics and testing, very dependent upon the pathogen. Unless we already know what we're fighting, it's kind of hard to do. Vaccines, very dependent on the pathogen. Therapeutics, very dependent on the pathogen. You get my point. It's like, I'm all for medical countermeasures, but unless we know what we're fighting, it's kind of hard to prepare. All right, so policies, plans, and procedures, these are all good. Again, back in the dark ages when I was working on pandemic preparedness, encouraging businesses to plan for a pandemic, encouraging them to think about their employees. And again, I think just about everybody experienced reduced occupancy, work from home. Some of us now benefit from it. But again, that still didn't answer everything. And then let's talk about personal protective equipment, such as masks. It is such a political issue in the United States. It's just, if you put on a mask, they assume you're a Democrat. If you're not wearing a mask, they assume you're a Republican. It just seems ridiculous. All right. So anyway, but that's just, people don't want to wear them. The other point I want to make about sort of the, now that we're going to switch to engineering, is most of these interventions are all about source control. If sick people don't go in the building, they won't infect other people. All right, so let's talk about engineering controls. Like I said, I'm really excited. We've got good ventilation in this room. And I say there are 3 proven methods with a star. All right, so how does ventilation work? Basically dilutes whatever contaminants are in your air in your room and takes them out of the room. We have filtration, which removes them through a filter. That works really well. Germicidal UV at 254. I was in Ed Nardell's office, 15 years ago. We were talking about it worked then. It still works now. So these are proven controls in the toolbox. All right. So now, before I get to the Far-UV workshop, we had a workshop at Hopkins in April, bringing together engineers and epidemiologists. And it was really hard to convince the epidemiologists to show up. But fortunately, I had good colleagues who are in this room who helped me convince them to come. And it was talking about aerosol transmission and modeling and so on, and what do we really need to know? Because there are many people here who said COVID is airborne. What's wrong with these? Why doesn't anyone understand? A lot of people still don't understand. Okay, so let's just tackle this. This is really important. So anyway, what are the gaps, opportunities, and a publication question? So this was an eye-opener. This is a slide from David Fissman at the University of Toronto, and he's one of the few epidemiologists I know who actually also understands the engineering controls. So let's just take one term here, and that is mixing. All right, so all the engineers say, well, how well is the air mixing in this room? Is it mixing well or not? The epidemiologists, when they walk into this room, they don't think about the mixing. They think about the people in the room and who got sick from whom. So, and there are other examples here, but this, to me, this is one of our most important workshops because the leading indoor air people are now understanding what the epidemiologists think, how they think about the problem. Because the epidemiologists and the indoor air people are trying to both save us. But anyway, so hopefully now we're working together. All right. So now this is the workshop that everyone's been waiting for, evaluating the health and policy implications of Far-UV technology. It was a small in-person workshop in February in Washington, D.C. We had, I think, at least 15 people who work for the U.S. government and a range of experts, quite a few who are here. I apologize to the people I couldn't include because it was small. It was off the record and not for attribution. And what that meant is that people could ask dumb questions. It would be fine for them to change their mind and so on. And we're preparing a publication for policymakers. And again, here I want to thank Effective Giving, Blueprint Biosecurity, and the Oslo Project for helping with funding for that. So what were the findings? Okay, you know this. Far-UV reduces concentrations of bacteria and viruses indoors, all right? Using Far-UV compares well with other disinfection methods with regard to energy usage, okay? It's energy efficient. It appears to be safe for human tissues, including skin and eyes. Let's not forget 254. It remains safe and effective when installed and maintained properly. Now, there is one caveat. I am a chemist. Far-UV deployment conditions need to be optimized for disinfection while minimizing the risk of ozone formation and other disinfection byproducts. Okay. So, and again, this is about developing policy. So what recommendations? We said, okay, let's implement these solutions anywhere right now where there are highly infectious aerosols. There are lots of conditions where there are highly infectious aerosols. Let's just start implementing them. Now, we do need some more research. And again, as somebody who funded research and works in policy, you know, sometimes you just have to make a policy given what you know now. You can't say, oh, wait, 3 years from now we're going to know so much more. No, we need to make decisions now. So we need continued research, but and again, this is U.S. focused. We would like the U.S. government, this is Hopkins people talking now, should develop guidance for Far-UV similar to that guidance that was developed in 2009. All right, so conclusions, Far-UV, it's in the pandemic toolbox, okay? And it's basically our best technology for rapid deployment if we have a big problem. Remember, those cows are all, they're, transmitting whatever, however, no, it's not airborne yet. However, we need more research. Yes, we need more research. All right, so what are the next steps? So, well, we've got to get the paper out, but to then give to the policymakers, and then we need to sit down and talk with them in terms of, well, does this, this works, given what we know now, it should be deployed, and there still needs to be a little bit more work done. Now, to really move the needle, the second item is not Hopkins specific. It's about the U.S. National Academies of Sciences, Engineering, Medicine. They're trying to raise money, I think $400,000, half of which has to come from philanthropy or a nonprofit or government, to have a workshop to, again, continue to advance the policy and so on. So anyway, like I said, I used to give away money, sorry. I gave away $200 million, I'm done with that. Now I'm trying to spend other people's money to advance good work. So so on that, I thank you. I'm happy to take questions, and I think one of the big things to remember is the people who get the work done, who have the ideas, have the creativity, sell the products, make the products. It's the people who will make it happen, and I'm confident the people in this room will make it happen. Thank you.